So David, how are you?
I'm doing fine, Todd. How are you?
I am really enjoying the beginning of spring, and I feel like we're in the annual tradition of different advocates from different specialties and different aspects of our economy heading up to Capitol Hill to meet with their members of Congress, their senators, and their representatives. Does it seem like it's that time again?
It does. It's what we call fly-in time, and our guest today knows it extremely well.
So let's introduce our guest, Zach Kribs. Zach, how are you?
I'm doing well. Pleased to be joining you during this busy season. We also call it appropriation season because it's the time of the year when a lot of congressional offices are pulling together their funding asks, which is why a lot of groups like ASN like to be on the Hill during this time to make sure that our asks get profiled.
Well, great. Welcome and thank you. And I do want to start with something that we try to remind people of every time we talk about appropriations, which is those are really that process is for discretionary programs. So that's the Congress has discretion working with the president to finalize funding for these programs. So we're not talking about things like Medicare and Medicaid. We're specifically talking about the Health Resources and Services Administration or the Department of Veterans Affairs or the National Institutes of Health. So I did want to just sort of establish that if that's okay.
Absolutely. I think that's a very important point. And I think the other important point is just how weird the government's fiscal calendar is, which I think is a point we've made on this podcast before. So the fiscal year for the government starts October 1st of the year. And hypothetically, all of the discretionary funding bills should be passed by that date. Now, of course, recently they have not been. But I think that's the other thing to keep in mind when you're orienting towards appropriations and funding conversations.
So why don't we jump in and just talk about, recently a group of advocates representing ASN and other members of the kidney community were on the Hill, and they were meeting both on the Senate side and the House side. I guess to just get us started, can you just give us a sense as to, the overall numbers, the number of people, the number of visits, and then we can get into some of the specific issues that the group was advocating for.
I'd be happy to. I think the issues that our ASM members were advocating for and the advocates that we brought in are actually really closely connected in this instance. And we opted for a small group of 21 advocates who are largely experts in the transplant system. Because the same group of folks were on the Hill last year advocating for the Securing the U.S. OPTN Act, which passed in record time. And this year, they wanted to come to the Hill to talk about the need to fund the changes that were called for in the Securing the OPTN Act. So some nice continuity there.
Yeah, and we will be using the term sus OPTN, which is one of the all-time worst acronyms, but it does shorten a very long title for the bill. So David, you've been uncharacteristically quiet through the beginning of this discussion. Anything you want to add in terms of the as we sort of set the table here for what happened recently on the Hill?
No, no, I'm just being quiet because Zach knows the stuff forwards and backwards, but I do think I was there myself, and I do believe that it was one of the more singularly focused appropriations requests and meetings. Zach, I noticed that a lot in the meetings. I heard other people saying the same thing. Staff seemed to be very much, they seemed to be very much appreciative of a very sharply focused request that was not kind of just, it was very focused. So just put it to you that way. And it really went after something that they could connect in their mind. Passage of the bill last year and funding of the efforts to make it come, to make it come to fruition. So I thought it was a very clean ask, and I thought it made a lot of sense strategically. So I did enjoy the day myself very much.
As did I. I always enjoy the chance to work closely with ASN members on issues that they feel passionate about. And I think this connects back to appropriation season. I think it's very common during this time of year for congressional offices to have their days filled with back-to-back meetings, where advocates will talk about really all aspects of federal government funding that are important across the country. And so when you can bring in a group of advocates who really know their stuff and who are very focused on one message, it can be a very effective opportunity. I heard a lot of the same feedback. I heard a lot of congressional offices saying, this is actually the first time someone's been able to explain some of these complex ideas to me in a way that actually made sense. And I think that just goes to show the importance of involving our physician leaders in conversations with policy leaders.
So, Zach, just to jump into it, so what specifically was the message for the fly-in?
The ask was pretty simple this year. It was to increase the funding that's going to the transplant system, so specifically the Health Resources and Services Administration's organ transplantation program, which most of which goes to fund the organ procurement and transplantation network. And we were asking for a total of $67 million in fiscal year 2025, which is this upcoming fiscal year that Congress is working on right now. And that's around an $8 million increase above fiscal year 2024, which was just finalized.
Zach, it seems to me that just to give our listeners a good feel for it, it seems to me that in a lot of ways this was a continuous ask that goes on from the last couple of years of focusing on, as you just mentioned, OPTN, as our members call it. But it really did seem to be the members of and their staff really did seem to be aware of the conversation around transplant. That had been going on in the last couple of years, and the efforts to really modernize that. So it wasn't coming at them, it seemed to me, out of the blue. Was that your impression too?
Absolutely, and that has been by design. ASN supports a number of policy goals, including a number of funding asks. I think we're all very familiar with our funding asks to increase funding for the National Institutes of Health, which have seen continued success year after year. We all have also in the past advocated for funding for innovation in kidney health, primarily through KidneyX, which has also seen a lot of success. This year, we wanted to increase the range and call for funding for the transplant system, which is something that our members have long supported, but we haven't called for quite so publicly. But because we were able to really connect it back to a lot of the reforms that ASM members had called for years and were initially passed in the Secure Needs OPTN Act and also through the HRSA OPTN Modernization Initiative, I think it was a really nice, clean story to be able to tell.
I guess, Zach, kind of curious as to what sort of pushback you got. I mean, there's always offices that even if you have, a message of bringing peace and tranquility and making the world perfect, there's someone who's against it. So curious as to what pushback you got and how you address those concerns.
I am honestly not giving a cop out. We did not receive any pushback on this funding ask this year. I think one thing I was a little taken aback by was the amount of literacy that congressional staffers had about the transplant system. And I think this really connects back to the work that ASN members have done over the past few years to educate Congress about why transplant care is important for patients and what sorts of reforms, particularly about making the system more transparent and more accountable, why that's so important to continue providing excellent patient care. So Congress seemed very prepared and ready to accept this funding ask, which was a really welcome to my ears. Does not mean it's successful yet. I think we want to see the ink dry in the paper before we call victory, but I was really pleased with the amount of support and interest and enthusiasm.
Yeah, I found, Zach, that they particularly, and I don't know, Lauren was up there as well, if you feel different. I noticed that they particularly focused in on a couple of things in particular. They very much focused in on modernizing IT. And I think that there's been so much discussion about IT in the last month and so with various things that have occurred. I think that really resonated with them a lot. And then also just the fact that the system had kind of been stagnant in how it did its bidding, its procurement bidding for a while. That really did resonate with them a lot, that there needed to be greater competition.
Right, and I think as you're well aware, ASN has not endorsed any particular government contractors. I think while that might be a big interest for the Hill, ASN's main focus of advocacy here is the need to have a system that really works on behalf of patients and utilizes best-in-class vendors or ideas from across the sphere, right? OPTN has a very large role and they have a very varied role. They have to be experts in everything from developing IT technology systems to developing organ policy, allocation policy. And that expertise might be carried by multiple entities and not necessarily all wrapped up in the same vendor. Now, they could be. But I think Congress really seems to understand that if you want to do the best by patients, you need to make sure that you're having the best in class ideas be able to serve patients.
So, David, you mentioned our producer, Lauren. So maybe just to give Lauren an opportunity, because she also was participating in these visits and helping navigate the members, on both sides of the Hill and into the offices. And apparently, I heard a rumor that some Dunkin' Donuts coffee was spilled. So hopefully, no one ruined their nice outfits. But Lauren, what was your perspective of the fly-in and sort of the receptiveness of the transplant policy?
Yes, thank you, Todd. Thankfully the Dunkin' Donuts coffee did miss everyone in the meeting. So shout out to
Okay.
that staffer that made sure it didn't hit any of us. But I always look forward to Hill Days. I think there's a lot of excitement both from members and staff. It's one of my favorite days of the year at ASN. This transplant Hill Day follows the Hill Day that we had last year, where we're originally trying to pass the SUS-OPTN bill. So it was really nice to have another one the following year that kind of follows up, making sure that those changes are made. My favorite part was getting to educate staffers, and I met with staffers from the states of Georgia and Texas that weren't really aware of kidney diseases. So being able to sit at the table, explain things to them, and get them on board and educate them on these really important issues is always very rewarding to me, and I think our members enjoy it as well.
So Lauren, I'm going to let it go that your favorite days of the year are when you get to go up to Capitol Hill with a group of people, although it is fun, and especially when there is a receptive audience. Um, I guess a question maybe, Zach, for you, can you help us understand sort of this specific fly-in within the context of other Hill-related activities? So I know you and Killian and Lauren and David and other members of the staff are up there, without ASN members. A lot of times people will come into town and they will, we'll arrange meetings with their members of Congress or with selected members of Congress. And then, of course, there are other organizations that organize Hill Days. They'll invite us to participate, and we'll go with either patient advocates or other members of the community, of the health professional community. So can you just sort of help us both from an organizational perspective, how you think this one fits with other ones, and then we can get into some of the issues sort of separately.
Yes, absolutely. Whenever I'm talking about the role of congressional advocacy, I like to start by outlining why is congressional advocacy important? How does Congress make decisions? And I think it all comes down to trust. Members of Congress need to have trusted sources of information, and there are probably no better people to be trusted sources of information on kidney health policy than physicians, kidney health physicians. And I think these advocacy days are a really good way to develop and strengthen the relationships between ASN members and their members of Congress, to allow for that trust to blossom. And I think we've seen the fruits of that over the years as different members of Congress have come to rely on some ASN members on a very frequent basis to help inform how they think about kidney health and kidney health policy.
Zach, one of the things you said just there really struck me because it is so true, and we need to repeat it all the time. But just for our listeners' point, I would like for them just to understand that I remember James Baker, when he was chief of staff for Ronald Reagan, said, "Trust is the coin of the realm." That's it. If you squander your trust with Congress or with the agencies, they remember it, and you have to be a straight shooter and you have to know what you're talking about. And ASN members consistently are able to bring a really precise and really accurate view of kidney care and the needs of kidney patients into discussions on the Hill and also at CMS and agencies. It's the same. And it is really struck that after a while, they really do come to understand and depend upon these people. And ASN staff, we are there to do the mechanics, but the reality is ASN's members are the ones who actually deliver the information and help really shape the decision.
Absolutely. And it is our job as staff to facilitate those connections and be the connector. I like to think of it. I think when we're looking and planning advocacy events, there are a lot of things that one might want to achieve during an advocacy event that might inform kind of which members, which participants might get invited to these meetings. Todd, you mentioned that oftentimes we work with patient organizations to have kind of a joint patient physician presence on the Hill. I think that's a very powerful approach. I think in this particular instance, because ASN members had been at the forefront of calling for the reforms of increased transparency and accountability in the transplant system last year, that was included in the Securing Act. It was a really nice through line to be able to bring largely that same group of members back to the Hill and call for funding for these changes and really demonstrate why, as from a physician, from a clinician's point of view, increasing the transparency in the transplant system, making sure we had a technology system that's more based in the 21st century, why these are real important changes that are happening and important to fund to improve patient care.
So Zach, just before we wrap up, kind of two related questions, specifically for the funding of the continued funding of the implementation of the SUS-OPTN Modernization Act. What's next? Can you just sort of walk us through? I know it's impossible to predict the future, and particularly in an election year with some of the challenges on Capitol Hill, but just how it should work. Let's do it that way, or how you think it should work. Maybe put it that way. Give you a little bit of wiggle room.
So there's two layers to this conversation, which I'll play out. I think in the near term, there is the immediate roadmap that has been set out by the administration and by Congress. So HRSA has released, the Health Resources and Services Administration has released a set of draft RFPs that they will finalize into complete RFPs, so they'll open up for competitive bidding. That'll be done sometime this summer. And that'll largely be utilizing the fiscal year 2024 funding. This collection of RFPs are what HRSA is calling the transitional series of contracts. The way I like to think about it is repairing the holes on the highway so you can more easily get traffic across and allow continued service for patients in the transplant system. The funding that we were on the Hill asking for. The funding that we were on the Hill in April asking for is for fiscal year 2025, and that'll be used to fund the FY25 series of RFPs, which HRSA is labeling the next generation contracts. And as HRSA is thinking about this is like the new highway that's being constructed in parallel to this existing highway they're trying to patch up. To make sure there's an even more advanced system capable of meeting patients' needs.
So Zach, just, as we close, I'm curious, and we focused almost entirely on transplant, but there's obviously a lot of other priorities, both within the discretionary funding arena, but also across Medicare, Medicaid, other aspects of the federal government. I'm just sort of curious, specifically around discretionary funding beyond the Health Resources and Services Administration. I know you and other members of the kidney community are really focused on other priorities. Can you just summarize those for us really quickly?
I can summarize them. I'm not sure how quick they will be. I think the easiest way to think about ASN's policy priorities are across kind of 5 goals. We want to make sure that we're intervening earlier in care and to diagnose and prevent and coordinate kidney health care. I think from a funding perspective, the National Kidney Foundation is leading funding ask to support surveillance, kidney disease surveillance at the CDC, which ASN supports. We already spent a lot of time talking about improving access to transplant care. ASN is a long champion of kidney health research and innovation. That looks like continued funding for the National Institutes of Health, particularly the National Institutes of Diabetes, Digestive, and Kidney Diseases, as well as the new Advanced Research for Health agency, which has recently announced that they are taking up innovation around the artificial kidney, which is very exciting. And of course, KidneyX, I think, continues to be a mainstay of ASN's appropriations advocacy. ASN is also a big champion of achieving equity in kidney health. And I would also broaden that to say making sure that the kidney health workforce is diverse and representative of the patients that we serve. I think a lot of the health equity appropriations asks are more tied with health workforce training, so like Title VII, for instance, but making sure, again, that we are preparing a workforce to meet the needs of patients now and in the future. And then I think that's also a really strong transition to our kind of fifth key priority, which is continuing to build the kidney health workforce. Again, I think a lot of course, graduate medical education funding through the Medicare program and Title VII through HRSA are kind of big appropriations mainstays. But we're always looking for new opportunities to help improve the opportunities that are available for kidney health physicians and researchers.
Well, thank you, Zach. And David, I'm going to give you the last word. So you can either comment on something Zach said or add, in addition to that exhaustive list, are there other things you just want to mention in closing that Lauren and I promise that we will touch on in future podcast episodes? And again, thanks, Zach.
Well, I'm going to first of all say, Zach, it was a nice job. It's been a continuous job for the last couple of years shepherding this, and it's a nice job, and you could see it coming to fruition. Now, I'm going to challenge Todd to talk about this next subject, because when we were having lunch in the United States Senate cafeteria, several of our members, as you remember, were quite fascinated, even though they've been there before, to discover that Senate bean soup is indeed a particular recipe cooked by the cafeterias in the United States Senate, and it's been a long time served of white beans and ham. And I must say, it is delicious.
Well, on that note, as a vegetarian, it's been a long time since I've had the Senate white bean soup, but I will attest that it was delicious. I'll also say that back in the 1980s, when I worked on Capitol Hill, the cafeteria in the Rayburn building made the best quiche I've ever had in my life, which is not something you would ever imagine. And you guys can make fun of me for being someone who enjoys quiche, but is healthy and vegetarian. So on that note, thanks again to Zach for joining us.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.